My name is Dr. Steve Sharfstein. I've been here 30 years. I'm the president and CEO. I've been CEO for 25 of those 30 years, and before that I was the medical director.
And I'm Dr. Robert Roca. I am the current medical director. I've been here since 1993, so that means I'm in my 23rd year here. And I started out in the role of the leader of the geriatric service, and I'm a geriatric psychiatrist. I still see patients frequently. I've got patients I've been seeing for decades whom I continue to see. And that's a essential part of what I do. As much as I spend time doing administrative work, I continue to see patients and love seeing patients.
I do too. I see some patients. It's been part of my identity forever. What animates a lot of my work here, both as CEO as well as when I see patients, is Moses Sheppard's dictum, meet a need that otherwise would not be met. And I think that's what we do here. We take care of people that no one else will take care of if we weren't here. And we do it in a way that I think is quality and compassion, and in a way that makes a difference in people's lives, individuals' lives, as well as for their families.
You mentioned the meet a need that would not otherwise be met, which of course is one of our core values. And one of the things that strikes me about the way that people approach their work here is the extent to which those core values mean something to them. The staff, the nursing staff, the physician staff really resonate with the idea that we are here to be respectful, that we're here to care, and that we're here to be leaders.
Yeah, I hear that all the time from outside reviewers who come in and take a look at the quality of care that we provide. The feedback that I get, and I'm sure you get, is the commitment of the staff and their caring and their sense of what the mission's all about.
Right. Yeah, and compassion is complicated. It certainly involves showing care, but compassionate care means more than simply than showing care and being empathic. It means all of those things, but it also means being able to provide care in a competent way, because compassion all by itself isn't what makes people well.
Right.
People need to be treated compassionately, they need to be treated respectfully, but they also need to be treated by people who have the knowledge and skills to help them get well. And the people who come here for treatment, I think, come here because they know they'll be treated respectfully, but they also know that they'll be treated by people who have the knowledge and skills to make a difference.
Absolutely. I was just talking with a major donor yesterday who wrote an end-of-the-year donation to Sheppard, and I was talking with her, and she said, Sheppard Pratt came across my desk, and I said, that's the only place in town that provides the kind of care, the quality of care that people need. And she was very committed and been very involved with us over the years, and very knowledgeable about all the other places in town.
Right.
And said Sheppard Pratt is the quality place.
I came here from another very good place. I was at Hopkins for many years as a trainee and as
I've heard of it.
Faculty member. And when I came here for my interview in 1993,
Which I remember.
Which you remember, one of the things that occurred to me was, I had this notion that there might not be any smart people in Baltimore who weren't at Hopkins, but I'm obviously wrong about that, because I was immediately impressed with the quality of the people I met here, and have continued to be. And I've was at UCLA before I was at Hopkins, and I can say with confidence that I've never been a place where people are treated better, or where people could count on getting better care than they get here.
Right. One of the pleasures of being the CEO is walking around and talking with people and seeing the pleasure that they get from providing the kind of care that we provide. And seeing the same people over the years, and watching them grow into their jobs and into new jobs, and becoming even better therapists over time.
Right. I've been asked what is that I love about working here. And it's there are a couple of things that come to mind. One is I love seeing my patients get better, and they do get better. I mean, I saw a fellow last evening I've been worried about for some time, and I knew instantly within the first few seconds of seeing him that he turned the corner and he was better. And there's nothing that's more exhilarating than seeing that. And so that's fabulous, but it's also fabulous working shoulder to shoulder with people who feel the same way about that, who want nothing more than to see their patients get better. And that's something that you see here, and it animates everybody who comes here.
You know, also it's the scope of our services that we take care of people of all ages and many difficult diagnoses, rare diagnoses. And you know, in not only in the hospital, but in our day programs and our outpatient programs, and that is very important contribution to the Baltimore community, in that we are a major provider, public health oriented provider that takes on populations, not just small numbers, but very large numbers. But again, I think we do our work patient by patient, family by family, but the numbers are so impressive, and that's part of the new Sheppard. When I first got here in 1986, we took care of far fewer people than we take care of today, and I'm very proud of the fact that that we are the place that people can turn to of all ages, all socioeconomic backgrounds, and different cultures, different languages. It's just a wonderful model, not just in Maryland, but nationally.
You know, we opened our doors 125 years ago this year, and I've thought, what would Moses Sheppard and Enoch Pratt think if they came back and looked at what Sheppard Pratt had become, really. I mean, what they envisioned 125 years ago, Moses Sheppard, even more than that. He endowed Sheppard Pratt in the 1850s and didn't live to see his dream realized. But if folks came back 125 years later, they would be astonished to see what this vision has given rise to. The original vision was for a little hospital sort of tucked away in rural Baltimore County. I think it was the first hospital in Baltimore County when it was built.
An asylum.
An asylum, right. It was going to be the Sheppard Asylum, and it was going to be remote and tucked away in a part of the county where nobody else lived. And here we are 100 plus years later with a footprint that extends across the state, with 2 hospital campuses, with schools, with residential facilities, with outpatient clinics, serving over 70,000 people in a given year, of all ages, 5 to 95, all diagnoses.
I'd love to show Moses Sheppard and Enoch Pratt telepsychiatry.
That's right. That's right.
And see what they would say about our broadcasting, our care to the remote regions of the state.
Right. So we certainly do the things you normally consider part of the repertoire of psychiatric treatments. Talk therapies of different kinds and pharmacologic treatments certainly. But technology is more and more important, and telepsychiatry is a way of extending our reach across geographic expanses we wouldn't otherwise be able to make our way across. And psychiatry is very much in demand. There are far fewer psychiatrists around than the need would require, and this is our effort to try to help solve that problem.